and welcome to the December episode of Fitness Coaching with Lois. I'm Lois, your host from Fitness Coaching. We're a traveling personal training service specializing in working with people that are post-injury or post-surgery, and they finished through physical therapy and now they need to go to the next step. So today we're at Randolph Pain and Relief Wellness Center, and I have three wonderful guests with me today. So we have Dr. Michael Solomonov, who is a pain management and anesthesiologist doctor, and he specializes in, I want to make sure I get it right, regenerative medicine. And we have Dr. David Simon, who is a chiropractor and who owns Randolph Pain and Relief Wellness Center. And then we have a massage therapist today with us, and Tara Hamburger, known as Hams, right?
Hammy.
Okay. So we're talking today about hips and knee issues, and we're going to start talking with Dr. David today. So, when we talk about the biggest challenge that people face when experiencing hip and knee pain, your patients, what do they feel when they're experiencing hip and knee pain? What's like the first thing that they're feeling?
Well, I think there's two types of hip and knee pain.
Okay.
Basically, sometimes you know when the accident happened, and you were playing a sport and you felt something happen. So you know that at that point you were injured. Then there's the other type of person where they wake up one morning or they're walking out of nowhere and all of a sudden they hurt their knee and their hip. And I think that's the most frustrating. So you have a person who knows exactly what happened, they take action, and they accept the fact that they have an injury, right? But the person who doesn't know what happened, it's very concerning, because you're just like, well, why did I have knee pain? Why do I have hip pain? It just started out of nowhere. This is really odd. So I think that's one of the most challenging things for people with knee and hip pain.
Awesome. So yeah, my husband, who is a patient of Randolph Pain and Relief Wellness Center, I'm going to talk about him for a second, so if you're watching, hi Annie. But yeah, he got up funny. He was sitting on the couch and just got up funny, and he had a minor tear in his meniscus. So wound up not having surgery, fortunately, but was able to rehab himself through physical therapy. But it's scary because you're like, what the heck did I do?
Pain is always scary.
Yeah.
It's personal, it's individual for everybody, and that brings me to another point that I wanted to add.
Yeah.
Is he had a meniscus tear.
Yeah.
So either it's structural problem or it's a non-structural problem.
Right.
And tears and broken bones and fractures, dislocations, those are all structural problems.
Okay, very cool. So Dr. Solomonov, I heard that you had a knee injury skiing. So is that how you got into this field in the first place?
Yes, I knew exactly when and what happens. I had a ski injury of my ACL. It's a typical ski injury. And I was in physical therapy for more than a year. Although I improved dramatically, I couldn't do my regular activities that I really love, biking and jogging. And I was considering doing a surgery, replacement of my ACL, but fortunately I discovered regenerative medicine when we use our own ability to heal using stem cells and other blood product. And I was treated with the stem cells at Regenix in Denver, Colorado, and 4 weeks after the treatment I was able to run 3 miles.
Wow, that's spectacular.
Yes.
So just through using what we already have within our bodies, we don't have to necessarily have surgery, is what you're saying.
Absolutely, that's
So
new.
it's an option. It's another option that we can use.
Yes, that's a new specialty, very rapidly developing, and there's not a lot of science behind it. It's not magic anymore.
Yeah, absolutely. Now, just curious, I'm sure a lot of people are wondering this question like I am. Is it something that's covered under insurance, or is it private pay? And, recovery time, is it faster?
It takes time because to recover. I mean, this is a minimally invasive usual procedure. It's
Okay.
usually done through the needle without incision, and that shortens the recovery. Okay, it's not covered by insurance yet. Although a lot of self-funded insurance companies are now considering covering, and some of them are covered the cost of the procedures.
That's great. That's really great. So that gives you another option if you don't want to have surgery that invasive surgery and all of the recovery time. I'm sure it shortens the recovery time as well. So that's great. David, what can people do to prevent some of these injuries that you see on a day-to-day basis?
Well, regular things that everybody should be doing, but a lot of us don't.
Mm-hmm.
Stretching,
Mm-hmm.
wearing the proper shoes, doing low impact exercises, such as, first of all, if you're going to do low impact, that would be walking or swimming. And if you're going to do weightlifting and squats and lunges, it's good. If you don't know how to do it, it's good to have a trainer so they can actually do it the right way and prevent having a knee injury while working out.
Yeah, I see that a lot when I see people exercise, is that it's not necessarily the exercise that's the bad thing, it's how they're exercising and using weight before people are ready. So, do you have anything to add to that, Tara?
I find that a lot. A lot of my clients are, lifting like this heavy stuff. And I'm like, you don't need to be lifting, and you shouldn't be doing these hard workouts the way you're doing. Like, they're doing these crazy, these boot camps and these, and these trainers, not putting them down, but they're overdoing it with these people.
Pushing
and everybody's
too fast.
bio-individual.
Yeah.
So to me, it's just that I feel that there's a lot of places, like what you probably do, is that you assess the client. You see what they can do and what they can't do.
Right.
And I find that most of my clients have SI issues.
What's an SI?
The SI joint,
just for people
the
that
joint
don't know what it is.
that is down here. They basically
Sacroiliac joint?
the
Right.
sacroiliac joint. Thank you. And
Which is in your lower back tissue.
Yes.
and what happens is that you can pull it very easily. I've done it, and just by massaging. So you got to be careful. It's the structural. You watching your structure. And a lot of my clients have IT band issues. It pulls on their knees, so it all starts down, and it's amazing. That's why I love what I do.
That's great. That's
Yeah,
great.
yeah.
So I've heard from different physical therapists that rolling out, especially with the IT band, that's a bad thing to do. Do you want to?
I don't recommend the rolling. No, it's not my thing. I mean, I really try to get clients to come in a few times, like at first, just to get everything released. And if it's something, if I come to a point, like sometimes I'll have them come in like for 3 times, so I can assess different areas each time. I have an hour with them. And then if I feel there's something more, that's when I will send them to Dr. Simon, and then he, from there, will know what they need to do medically.
Does anybody else want to talk about rolling out while we're on the topic?
The foam rollers?
Yeah.
I find a lot of people like it. I think they think it feels good, and I think if you could do it properly without overdoing it.
I think that's the key.
That's
there.
the key. That's the key. That's the
Properly
key.
and
Right.
not overdoing it. So I think it's really easy. I see some people doing rolling out, and they're putting their entire body weight on
I've
something.
seen hematoma. I've seen people really bruise themselves terribly.
Yeah.
Yeah.
Yeah. So just if you want to do things, making sure that you get the proper advice and that you're getting it from knowledgeable information from knowledgeable individuals, I think is the key there. So what are some, Dr. David, what are some non-invasive ways that we can,
Advil.
okay.
And nowadays we're trying to stay away from the NSAIDs and the medication.
Right.
So there's rest, there's ice, there's physical therapy, there's acupuncture, there's massage therapy. Non-invasive is what we talked about. If it's a structural issue, that it's not only inflammatory, then we just refer to Dr. Solomonov, and hopefully regenerative medicine such as stem cells or PRP is the answer and can prevent or avoid someone from going into surgery. And by the way, so it leads me to a good point, which is most non-structural knee pain is from inflammation. So we have a targeted cryotherapy machine, which we could just basically take the target and put it right on the knee or the hip, and it takes away inflammation almost instantly, and it feels great.
I've had experience using cryo. I'm a big fan of it. I had patellofemoral syndrome in my left knee, and within this is not a plug at all, although it is a plug. I've done it myself. I've had success with it, and that's not to say that it always works for everyone, but it does definitely decrease inflammation. I within a few treatments felt amazing, and it felt great since. So
Yeah, most people find that. If it's a non-structural issue, it's a great thing to actually do. And it's really a replacement for over-the-counter medications like Advil, ibuprofen, Tylenol. It works in 2 minutes, and usually within 3 or 4 visits, you notice a major difference. And I call this like ice on steroids.
Yeah.
It's basically the way it is.
And I find with that I think it's important that you go to a medical place to get it done.
Yeah.
Okay.
There's
That's
too
a
many
great
cryo
point.
places out there that don't understand injury. So it's very important to me, because I've worked in that industry, is to be, a medically inclined, whether it's a chiropractor, MD, somebody that understands the structure of the body, where the pain is, and how long to do it, and how. There's also a special device to make sure that your skin's not going, your body's not getting too cold, because that can hurt you.
Absolutely. So I guess my next question about cryotherapy is, what do you think about those big tanks that they put people in?
I talk about
Are those
this all the time.
beneficial?
Yeah, they are beneficial. So, the reason why we use the targeted cryotherapy is because we have most people that come to us with very targeted problems. I don't think the big chamber gets as targeted. Number two, I think what Tara was saying about the skin and at the right temperature, those big chambers are all liquid nitrogen, which has, if it leaks out, which it has, it can cause danger and burns.
Yes, I've treated burns.
Right.
From
So we use refrigerated technology, so it's air blowing out, and you're not having a chance of liquid nitrogen coming out. So if you just need overall wellness and overall kind of inflammation for the whole body, I think the tanks are good, but sometimes I just don't agree with the liquid nitrogen aspect of it. So that's why we go with the targeted. It's safer and it targets the area.
Fantastic. That's great. So what can we do to speed up recovery after exercise?
After exercise?
Yeah.
Oh, well, cryotherapy. I mean, it's really rejuvenation. So we have another office over at Athletic Republic where we do the 360 approach. A lot of the kids and the athletes and the adults, they come to us and get the cryotherapy on sore areas, especially knees and shoulders after they're working out. It decreases the inflammation right away. We do stretching, we do focalized massage on areas. But a lot of people, it takes 2 minutes. They're exercising, they feel a little something in their knee, or they know that they did legs and their legs are gonna be sore. We just put the cryotherapy right on it, and it really helps recovery very quickly.
Very good. That's great. So just some personal questions, because I like to get personal, and everybody loves personal questions. When it comes to on a day-to-day basis, do you guys exercise? If so, how much?
Well, I run 4 times a week.
4 times a week?
Yeah, I do mountain biking.
That's great. How about you, David?
I've been bad since we opened the second office. So, because if I get home at night,
You're normal. You're normal.
No, it's
Hi,
normal.
you're normal.
3 kids,
Yeah.
I get busy, but no, I do want to get back into it. But my favorite exercises is really just very simple weightlifting, playing basketball, and if I can get myself back up at 4 in the morning, then I'll start doing it again.
Yeah, 4 in the morning, super early.
Yeah.
One of my trainers, I call her a rock star, Krista. She's working out at 4 a.m. every day. Before she trains clients, she works out that early.
I used to do the same thing.
I bow down to her. Yeah,
Yes.
she's great. How about you, Tara? You work out?
Right now, no. It's a lot of transitions. So I do a lot of deep tissue work. And then when I'm here, though, I make sure I'm walking. I never sit down. So
Yeah,
to
very
me,
active.
I want to keep my blood going and everything. I used to get on my elliptical at home. It's a brand new Nordic track. I used to get at least 20 minutes every single day. Hasn't been happening, but I will be doing it after the new year.
I should correct myself though. I do actually do daily exercises. I do postural exercises.
Okay.
Because either I'm sitting down at the desk a lot or I'm practicing chiropractic.
Right.
And I don't want to injure myself. So
Absolutely.
I do rotator cuff exercises for my lower traps and for my lower back. It takes 5 to 10 minutes a day, but it's a maintenance exercise.
But at least it's something. So
Well, it
even
makes
if,
me feel good.
but even if you can't, what the point is that even if you can't fit in a whole 45-minute workout or an hour workout with a personal trainer at a facility or in your house, you can still do something on a day-to-day basis, walking around or doing some minor exercises. Great. What's your favorite thing to do to de-stress?
Mountain biking.
Mountain biking. So that's your so he uses exercise. That's awesome. How about you, David? What do you do?
I like to read
de-stress?
books.
Books. That's awesome. What's your favorite book?
Oh, I don't know. I have like 5,000 piled up around my bed in my
All
bedroom.
over?
So yeah, so
What are you into right now?
usually it's let's see, what do I have right now? Right now, a lot of it's about technology
Okay.
and the cloud platforms because we're moving to the cloud,
Okay.
And so our operations
So
in the office.
business-based stuff.
Business-based, yeah.
Good. That's great. Keep on learning. How about you, Tara? What did you do?
I
to
spend
de-stress?
time with my cockapoos, and I love movies.
Oh, yeah.
I'm a movie
That's
person.
Great. I'm a movie person too.
Yeah, and I like history.
Awesome.
Yeah, so I watch the Smithsonian Channel a lot. So
That's fantastic. So, how about sleep? So we always talk about sleep and being regenerative and how important it is, and that we all need more. How much sleep do you get a night, Mike?
About 7 hours.
7 hours. Great. How about you?
Oh, you don't want to know.
Be normal for
All right,
people, right?
I get like 4 hours of sleep a night.
4 hours.
Yes.
Okay. All right.
I usually get about 8 or 9.
Okay. That's great.
I have to
Yeah.
to replenish myself. But the past probably week, because of Christmas and learning new jobs and stuff, about 4 hours.
So it's recommended, we know, right? 7 to 8, but if you can function on less, some people don't require as much. One of my clients, she can, oh my goodness, she can function on like 2 hours of sleep, which to me is just.
It's great, you get more done.
It's your
That's
adrenaline
what
kind of
she-
kicks in too, when you're like really
She
moving
says that
around.
she can do
yeah.
it. I've yet to figure that out.
Yeah.
And then my last question is, what about drinking water? What do you think? How much water are you drinking?
Well, I don't do that. Like you have to drink 3 liters or whatever.
Yeah, I don't either.
I just drink when I need to.
You drink what you need to. Good.
I actually try to drink the 8 glasses a day.
Okay.
I make it a conscious effort to do that.
Good.
I drink way too much.
Yeah.
Yeah, she'll
Water.
tell you.
Water.
Yes. Oh no, I don't drink alcohol. Yeah, I cut that out a long time ago. But no, I am terrible. I drink like a lot of these a day because I exude so much energy. I think just in myself. So I constantly have. She'll tell you. I constantly have. It's funny.
Yeah, I'm a big fan of drinking water. I always say that when people are like, oh, drink half your weight in ounces or 8 to 10 glasses, look at your urine. Look in the toilet.
Yes.
That's
If
your
it's
indicator.
Nice,
right?
nice and bright.
Yep.
You know that you're getting in enough.
Yeah,
Right.
it's nice and clear and
Yeah.
there's not a smell to it, then you know you're getting
They already say though, if you're thirsty, you've
You're
already
ready.
waited too late.
Yeah, yeah.
Right,
So
right.
don't wait till you're thirsty, drink all day, especially in the winter.
Yes.
So, Mike, thank you, David, and Tara. Thank you so
you.
much.
Thank
you for
Thank you.
watching out there on Facebook. If you have any questions, please feel free to reach out to us. I'm also putting out an Achy Knees and Hips campaign with a bunch of different exercises that you can do on a day-to-day basis that are knee-friendly. So if you have any issues with your knees, that you can just chime in and get that. I'm going to post that in the link on the bottom. So thank you so much for watching and have a great rest of your day. Take care.